Let's discuss some practice questions in relation to immune content within the pediatric section. As with all of our practice question videos, I do ask that you pause the video after we initially review the question and the answer options. That way you can use your own knowledge and foundation to come to the correct answer independently, and then you can resume the video so that we can review that answer and the rationale together. Multiple response, select all that apply, physiological integrity and health promotion and maintenance. The nurse is providing education to an HIV positive mother regarding the care of her newborn child. Which of the following would the nurse include in the teaching? Select all that apply. So you have an HIV positive mother and a newborn child. Read through these statements, which are true, and meaning which would the nurse include in the teaching and which are false. All right, so it's important that the newborn is assessed once monthly in a clinic after hospital discharge. Also, the inactivated influenza vaccine will be given yearly, and then the newborn will have a P24 antigen assay drawn at birth. So, of course, AIDS is a disorder caused by HIV and characterized by dysfunction of the immune system. So, the most opportunistic infection in children in fighting with HIV is that of pneumocystis pneumonia, which occurs more frequently between the ages of 3 and 6 months when HIV status may be undetermined. So a cough is the most common sign of this particular opportunistic infection. So you always want to report the presence of a cough. Immunizations against common childhood illnesses are recommended for all children exposed to or infected with HIV. So the inactivated influenza vaccine is usually given IM. That will be administered yearly. The Hep B vaccine is administered according to the recommended immunization schedule. Infants born to HIV-infected mothers, they need to be screened for the HIV antigen. So the detection of HIV in infants is confirmed by drawing a P24 antigen assay, a virus culture of HIV, or polymerase chain reaction. So just to know that testing will be performed when the baby is born. Multiple response, select all that apply, physiological integrity. A school nurse is providing education to a group of parents about chickenpox. Which of the following statements would the nurse include? Select all that apply. So which of these statements are true regarding chickenpox? All right, so chickenpox is a highly contagious viral infection caused by the varicella zoster virus. The incubation period for chickenpox is 7 to 21 days. Chickenpox is highly contagious and can be spread through respiratory secretions and then also contact with contaminated surfaces. The characteristic rash of chickenpox typically begins on the face and then spreads to the trunk and the extremities. While most people who have had chickenpox are immune to the virus, immunity may wane over time, and a person can then develop shingles, which is a painful rash caused by the reactivation of the virus. Complications of chickenpox can include bacterial skin infections or encephalitis, as well as pneumonia and death, particularly in immunocompromised patients. So vaccination is always going to be the most effective way to prevent chickenpox. All right, classic multiple choice physiological integrity. The nurse is volunteering on a pediatric mission trip overseas when a 4-year-old patient presents with complaints of a sore throat, malaise, and difficulty swallowing. Upon assessment, the nurse notes the following. Temp is 99.9. There's foul-smelling mucopurulent nasal discharge and neck edema or the presence of a bull neck. So based upon these assessment findings, the nurse concludes that the patient is presenting with which of the following disease processes. So you have to remember the nurse is likely in an underserved area overseas. You have a 4-year-old patient presenting with the presence of a bull neck and foul-smelling mucopurulent nasal discharge. So based upon those assessment findings, what disease process should the nurse be thinking about? All right, the correct answer is diphtheria. So, diphtheria is a serious bacterial infection that primarily affects the throat and the upper respiratory tract. So, the classic findings of diphtheria include a sore throat, which is usually one of the first symptoms. It can be accompanied with difficulty swallowing as well. There can also be a pseudomembrane formation, which is a thick grayish white membrane that will form in the back of the throat. This can also obstruct the airway, making it difficult for the patient to breathe. This patient will also present with a low-grade fever. They will have swollen neck glands, as the lymph nodes in the neck will often be swollen and tender. They will present with hoarseness, malaise, and then nasal discharge as well. All right, this is a drop-down style question, physiological integrity. A 7-year-old patient presents to the clinic with a fever and sore throat for the past 3 days. Upon exam, the child's tonsils are enlarged and have a white exudate. The child also has a sandpaper rash on the trunk and extremities. The rash is red and slightly raised, and it blanches when pressure is applied. The child's tongue is swollen and has a white coating with red strawberry spots. Based upon the exam findings, the nurse concludes that the patient is presenting with blank and anticipates the need for blank precautions. So there are a few very characteristic assessment findings here. We have a sandpaper type rash and red strawberry spots on the patient's tongue. So knowing that, recognizing those assessment findings, what disease process is the patient presenting with, and then what precautions would you need for that disease process. All right, so characteristic of scarlet fever is that fine sandpaper type rash and a red strawberry tongue. So be able to associate scarlet fever with those assessment findings. Also, this patient will need to be placed on airborne precautions until 24 hours after the initiation of antibiotics. Classic multiple choice physiological integrity. A 16-year-old patient presents to the clinic with complaints of fatigue, fever, and sore throat for the past week. Upon exam, the patient has enlarged tonsils with white patches and swollen cervical lymph nodes. The patient also has a low-grade fever and complains of a headache and muscle aches. Blood tests reveal an elevated white blood cell count and the presence of atypical lymphocytes. Upon physical exam, the nurse notes hepatosplenomegaly. The nurse plans to educate the patient on the importance of immediate reporting of which of the following. So I want you to review this again, review the assessment findings here, and you should think of a certain disease process that the patient is presenting with, and then what is the most important precaution for a patient with that disease process to take. All right, so you're going to recognize based on the enlarged tonsils, the sore throat, the fatigue, fever, that this patient is presenting with mono or infectious mononucleosis. So classic findings include the enlarged tonsils, lymphadenopathy, and then the hepatosplenomegaly. The primary concern for this patient is splenic rupture, which could be evidenced as abdominal pain or pain between the shoulder blades. So it's important that the patient immediately report abdominal pain if abdominal pain occurs.